Hello everyone, we've been telling you for a while that what really matters when it comes to coronavirus is not the number of cases, but the number of deaths. So today, we're going to try and analyze the deaths that are taking place in India to try and get an overall perspective of what exactly is happening. Now, when it comes to deaths, yesterday was perhaps the worst day that we have seen, nearly 400 deaths across India. And let's remember that just about 10 days or so ago, deaths were occurring at about 200 a day or thereabouts. So if it's 400 now, that's been a doubling in about 10, 12 days, and that's not necessarily good news. It perhaps gets a little scarier when you consider the fact that there is still some doubt about the official numbers that are being reported on deaths. In Delhi, for example, we've seen what the government is stating being vastly different from what some municipal commissioners, for example, are saying. And they are saying that actual deaths could be double of what has been officially reported. And that's obviously something to be concerned about. So one of the big things that everyone has been talking about is what is called the case fatality rate. What does that mean? You take the look at the total number of cases that you have, how many of those, and you compare that really with how many people have died. And that comes to a figure of something like 2.8%. And you've heard this discussed at great length. However, it has to be said that that's not necessarily the right way to look at it. Because if there's a new case that comes up, somebody's tested and that person is positive, it is going to take 12 days or 14 days for that person to either recover or for that person to get really seriously ill and die. So perhaps a number that we should really be looking at, take a look at the deaths that are occurring and you compare that with the total number of cases, let's say 12 days ago or 14 days ago, because people who were diagnosed 12 to 14 days ago are the people who would therefore be dying right now. So that may be an interesting sort of a comparison to try and make. And if you do that, you have that lag, and let's say you are to, for example, compare the 8,500 deaths that have taken place in India with the figure of cases that actually was there 12 to 14 days ago. This is just a ballpark way of trying to make a sense of what the numbers are. There were about 165,000 cases or so on May the 28th. So that actually leads to, if you look at the actual number of cases at that time and the deaths right now, it's about 5% of people have died. And there's another way of trying to come to that same figure. You look at resolved cases. All the cases which have ended either in somebody recovering or somebody dying. That's a figure we've often been tracking right here, out here on this Editor G show. So if you look at that figure, for every one person who dies in India, 17 people are recovering. Convert that into a percentage, what does that come to? That same figure of approximately 5%. It has to be said that this is somewhat better than the numbers we're seeing in the rest of the world. In the rest of the world, something like 10 people recover for every one person who dies. That becomes about 10% of people are dying and 90% of people are recovering. So in India, the figures are somewhat better than the global average, but we are still arriving at a figure of potential people who will die if they get coronavirus at 5% and not at that 2.8% fatality rate, case fatality rate, which means as we are forecasting for the future, if a city like Delhi says 500,000 people are going to end up getting the coronavirus by the end of July, then the number you've got to be thinking about is perhaps 5% of those people could be dying, which means 25,000 deaths. All of this, of course, is based on official data. Because that's the best source we have. We can't really guess what the numbers are. So official data are saying this. If the total number of cases is much higher than it is, then actually the death rate goes down. If the number of deaths is far more than it is, the death rate goes up. Also, must be said that there are really huge divergences in all of this. When it actually comes to states, from one state to the other, there are very, very big differences. So we do need to analyze that, and perhaps we'll do that tomorrow. But let's now take you through all the other big stories as well of the day, including what was happening on the border with Nepal.
Coronavirus patients are being treated worse than animals, the Supreme Court said on Friday as it pulled up the Delhi government amid spurt of virus cases in the national capital. In one case, a body was found in garbage, the court said, as it asked the Arvind Kejriwal government to explain the fall in testing in the national capital. Why has your testing gone down from 7,000 to 5,000 a day when Chennai and Mumbai have increased their testing?
In a relief for private employers, the Supreme Court on Friday said no action can be taken till the end of July against firms that have not paid wages to workers during the coronavirus lockdown. The top court said states must facilitate negotiations between employees and employers over wage payment and file their reports with the labour commissioners. The court also gave the centre 4 more weeks to file a reply on the legality of the March 29th notification that had ordered mandatory payment of full wages during the lockdown.
India on Friday recorded close to 11,000 new coronavirus infections and almost 400 deaths in the biggest single-day spike in the country. According to the Health Ministry data on Friday morning, there were 10,956 new cases and 396 deaths in the last 24 hours. This is for the first time that India has seen more than 10,000 cases in a day. Total number of Covid-19 infections in India is now touching 3 lakh with 2,97,535 cases. With 396 new deaths, the fatalities due to the virus have gone up to 8,498. Over 1,47,000 people have recovered so far.
Delhi Health Minister Satyendra Jain on Friday ruled out extending lockdown even as COVID-19 cases continue to spike in the capital. Delhi had reported its sharpest increase in the virus cases on Thursday with over 1,800 new cases. Over 1,000 people have died of the virus so far.
The Supreme Court on Friday took serious note of non-payment of salaries and lack of proper accommodation to doctors engaged in the fight against COVID-19, saying in a war you do not make soldiers unhappy. Travel extra mile and channel some extra money to address their grievances. The court should not be involved in the issue of non-payment of salary to healthcare workers and government should settle the issue, it said. The top court was hearing a plea by a doctor who alleged that frontline healthcare workers are not being paid salaries or their salaries are being cut or delayed.
Congress leader Rahul Gandhi again took on the Modi government for its COVID-19 response, accusing it of taking decisions unilaterally. During a conversation on COVID-19 with former US diplomat Nicholas Burns, Gandhi said that the government imposed a hard lockdown and the result was for everyone to see. He stated that sudden lockdown left thousands of migrant workers walking to their hometowns, adding that this type of episodic leadership is very, very disruptive. He, however, said that he understands India's DNA and is hopeful that India will emerge stronger from this crisis.
Delhi reported its highest spike in coronavirus cases on Thursday with 1,877 new cases, taking the total to over 34,000. The total number of deaths in the national capital has mounted to 1,085, with 65 more reported on Thursday, authorities said. There have, however, been discrepancies in the number of deaths reported by civic bodies and the government. The municipal corporations have reported over 2,000 deaths, while Delhi government has put the figure at 1,085. Mumbai's largest private laboratory has been barred from conducting coronavirus tests for the next 4 weeks, NDTV has reported. The civic body's move is likely to slow down testing capacity of the city, which is currently the country's biggest hotspot. The ban order comes from the BMC after alleged delays in the test reports. Delays in reports led to difficulties in contact tracing. It can lead to delayed treatment and in some cases death, the BMC said in its order. The lab, Metropolis, has admitted to the delays, saying part of the reason was that their staff had also contracted the infection. The centre has raised red flags for 5 states worst hit by the coronavirus pandemic, underlining the shortfalls in COVID care. The Cabinet Secretary has raised an alarm over glaring shortfalls in hospital inventory to a steady surge in confirmation rate and testing bottlenecks, the Indian Express has reported. The central government has warned Maharashtra, Tamil Nadu, Delhi, Gujarat and Uttar Pradesh that going by current trends, they are projected to fall short in terms of ICU beds and ventilators between June and August.
Alarm bells are ringing in Beijing as the Chinese capital reported 2 new cases of novel coronavirus in 24 hours and a total of 3 cases in 48 hours. It has been less than a week since Beijing lowered the outbreak emergency response to level 3, the second lowest. The city had gone without a domestic infection for 55 days when the first case was reported. 2 men working at China Meat Food Comprehensive Research Center were diagnosed with the disease and have been transferred to designated hospitals. Meanwhile, nearly 50 primary school students and teachers have been quarantined at home after a 4th grader's father was diagnosed with COVID-19. the first locally transmitted case in Beijing reported in nearly 2 months.